Thank you for joining us tonight at 5. I'm Brooke Buckner.
And I'm Faith Woodard. Tonight we begin with a national issue that could soon affect families here in Arkansas. Affordable Care Act tax credits are set to expire, making many government exchange health insurance plans more expensive.
THV 11's Maya Ellison talks with the local organizations trying to prepare those consumers.
Yeah, Faith, Brooke, it can be a complicated issue for many Arkansans to understand, but think of it like this. You got a special discount on your Netflix or Amazon account. Well, all of a sudden, you forgot that special discount would expire and the cost per month doubles. The problem with insurance, though, there's a lot more at stake than whether you can watch Stranger Things.
What we've heard is just, I don't know how to stay covered or keep my family covered if I'm going to have to pay $2,000 more a month.
That's the concern for more than 140,000 Arkansans who rely on Affordable Care Act premium tax credits to afford health insurance. And those credits, which lower monthly insurance bills, are set to expire after the Senate failed to pass 2 health care bills last week.
The Congressional Budget Office estimates that about 4 million Americans could lose coverage if these premium tax credits aren't extended. And so thousands of Arkansans are at risk of losing coverage.
So what are premium tax credits? According to the IRS, they're refundable credits designed to help individuals and families pay for health insurance purchased through the Affordable Care Act, essentially lowering monthly premiums. Without that assistance, experts say families are left to make difficult financial choices.
This is going to have a huge impact on lower to middle income families who aren't eligible for Medicaid but don't have other coverage options. So these are people who are buying insurance.
Camille Rishu says that loss of help impacts thousands of Arkansans. Just take a look at this example provided by Arkansas Advocates for Children and Families. A mother of 3 saw her monthly premium jump from $62 to about $404. Or another family seeing their premium increase from $19 to over $3,000. So basically, the coverage stays the same, the cost does not.
This is going to have a huge impact on lower to middle income families who aren't eligible for Medicaid but don't have other coverage options.
We at THV 11 received a statement from Senator Tom Cotton. It says in part that, quote, healthcare premiums are rising because Obamacare is not affordable. CBS News reports that lawmakers in Washington say negotiations are ongoing. And if no agreement is reached, some families could see their monthly insurance costs double starting in January.
Even small gaps in coverage can be catastrophic for families. Everybody benefits from more people having insurance coverage. And the flip side of that is that we all hurt whenever few of us have insurance coverage.
And those steep increases that were mentioned apply to people above certain income levels. People who qualify for Medicaid are still eligible for subsidies, and cheaper plans may be available that you can afford without them. If you're looking at a big bill, talk to an insurance agent or those advocates. They can help you shop around.